We are located at Bitters
Could you start that over?
Huh?
I wasn't ready.
You don't need that part. We are located at Bitters and 281. We do offer a bariatric 3-month membership. Okay, so if you're not a current member of a gym or you want to get started in a facility that caters a little bit more towards high-risk members, which includes obesity, but it also includes joint issues. It includes folks over 65, people with joint replacements or any other issues where you feel that maybe going to a Bally's or a Spectrum or a gym that caters more towards the already healthy might not be the most comfortable place for you to start. Our 3-month membership is $120. That includes being assigned a personal trainer. So when you go and complete your paperwork, you will be walked to our fitness area. A trainer will meet with you at that point, ask you if you understand the risks involved with starting a program, and if you would like to schedule an appointment with a trainer. That is part of your membership and what you are paying for. That trainer will then create a basic exercise program for you that ideally you're doing 3 times a week for a month. Then they'll encourage you to schedule an appointment after your first 30 days, and let's change your workout. Now let's go from moving to machines maybe to moving to some free weights and learn how to use that type of equipment and create another program for you. And in another 30 days, we'll schedule another appointment, your 3rd appointment, see what you liked, what you didn't, maybe incorporate some stability balls, some other exercises that you've seen in the gym maybe that interest you and you want to learn how to use. And then before you go, you can schedule a 4th appointment where you're like, okay, this is nowhere where I live, but I love it, but it's just not convenient for me. Can you create something that I can do at home or maybe in my gym where it's closer to work, or maybe I have a gym at work or access to a facility at home or something, and we can create that for you. So it starts you off on a great plan, structured plan for your weight loss. What I do when I come in here, obviously, is talk about exercise and the importance of it. What I have found in my years of doing this lecture, and we're going on 4, I think November will be 4 years that I've been doing this lecture, is that it's not about the exercise. For 99% of bariatric patients that come through here, it has nothing to do with lack of exercise. There have been periods in your life where you have been exerciseaholics. You've done the walking, you've done the classes, you've had a trainer, you've paid the gym memberships, you've done all of that. That has never been the part that has not allowed you to succeed. The part that you keep butting your head up against is the nutrition. And knowing what you're supposed to do, because I've yet in my 12 years of being in this business had anybody sit down in front of me whose goal is weight loss who has said, I have no idea what to do, Claudia. I have no idea how to eat right, what are the right foods. The question is, the answer, I guess, from the client is always, I know what to do. Well, then do it. That's kind of, it seems very easy, but it's like a Grand Canyon between knowing what to do and actually implementing that. And that goes for folks that have obesity-related issues, cholesterol and blood pressure issues, or just fitness issues. We all know what to do, whether it's 5 pounds you need to lose or 100, but it's doing that is just incredibly challenging. And one of the big tools that you have decided to give yourself is, okay, I'm going to be forced to control what I'm eating, okay? Because yes, I know what to do, and I know that having maybe baked chicken and a salad and maybe some brown rice is a better option. I still go home and just say, you know what, I don't feel like cooking. Let's get fast food, or let's order pizza, or let's do something that's easy and affordable for our family than me spending the time to cook. So that kind of becomes kind of the easy way out for a lot of us. And now with your procedures that you've had, whether it was a lap band, whether it was gastric bypass, your stomachs are roughly this big. Okay, so Big Mac isn't going to fit. Enchiladas aren't going to fit. Pizza certainly isn't going to fit. Okay, now will a bite of pizza fit? Yeah. So you still have to make those choices, and that's kind of one of the challenges as you go through this process, is still making the right choice, because nobody has gone in. You're all Dr. Gonzalez patients, correct? Cavazos, some? He didn't go in and not only bypass your belly, but bypass the signal that likes that type of food, right? You still have that ability to make the wrong choice. So ideally, you're going to use these first 6, 12, 18 months to learn how to make the right choices, because you're kind of being forced by the size of your stomach and the negative consequences of eating the wrong things, right? Doesn't mean you still don't want them, So you need to learn how to deal with that. And I encourage you to utilize the support groups that are a part of this program, your resources like myself, like Ann, like the psychologist, Dr. Cavazos, Dr. Ons, any of them, to figure out, how do I not want those foods? I know I can't eat them now, or at least a large portion of them, because I'm going to be sick or I can't have more than a bite. But that's going to change. And being 4 years into this program, I am encountering patients that are having issues. You know, they're gung-ho at the beginning and exercising 5 days a week, lifting weights, doing their cardiovascular training, progressing their training like they should. They're either members of HealthLink or their own gyms. They're doing great, but 3 months go by, 6 months go by, 12 months go by. I got off the wagon. Well, how? What happened? Well, a business trip or a family vacation, or just something came up and I got out of the rhythm of going to the gym, and now I kind of catch myself snacking on a potato chip here or there and kind of getting back into my old habits. Now, were they sitting here going, that's not going to be me, like you are right now? You're all saying in your head, well, that's not going to be me. I'm 100% committed to my health and my fitness, and that's why I've done this and gone through the surgery. Well, they were doing the same thing. They never thought that they were going to, rebound a little weight gain or have issues, or potentially, and I've seen it, 250 day of surgery, 3 years later, 250. That doesn't mean they didn't go from 250 to 150 and then back up to 250. But the weight's the same. And how do you think they're feeling? How do you feel when you go on a diet and lose a little weight and everybody says how great you look, and then 6 months later they see you and they're like, oh my gosh, you gained all the weight back. You did. And there's a shame that goes with that a little bit. So those patients tend to sometimes not come back to see the doctor. I don't want to be judged by the staff. I don't want to be judged by the doctor. I don't want to be told not to snack, because I know I'm not supposed to snack. It's not rocket science, but I just can't figure out how to do that. What I have done, along with my business partner Brandy, is we have decided to put together an accountability program. So Dr. Cavazos and I spoke a couple months back and said, what are you currently doing for folks that are having problems? Because ideally, 100% of your patients are successful and they go on and they maintain their weight loss. But what's happening to those that are struggling? He goes, we tell them not to snack, we offer them to come back, and then I talk to the staff, and they're like, Claudia, they don't come back. They don't want to admit that they have failed. They had surgery, for goodness sake. They don't want to admit that they failed after making such a huge life decision or life change. So what can we do to change that? So the reason we got your email addresses today is because what we've started is a bit of a newsletter that goes out to patients 1 month after your surgery. You're going to get a newsletter from me, and it's going to have a recap of kind of what we talked about today, because I know that half of you are brain dead right now, and you're attentive, you're listening, but it's going in one and out the other because you have no brain cells that are actually functioning at 100% right now. So you're going to get some of that information back at you in about a month when you're ready to take it in a little bit better. Where should I be in my fitness 1 month out? So you'll get the guidelines on walking and good shoes and heart rate training and things you should be looking at. How often should I be doing it? What intensity? How should I progress? That will be in your 1 month letter. In your 2 month newsletter, you get another newsletter. And that one will be strength training. Okay, you're 2 months out from surgery. This is what you should be doing on a strength training program if you're not already. And give you some guidelines on strength training, what muscle groups you should train, how you should train, how often, sets and repetitions, all that stuff, how it benefits your fat loss. 3 months out, okay, now where should I be with my exercise? Because I still shouldn't be doing what I was doing this week, which is just walking. I should be progressing that, different ways to do that. So I'm going to try to put together 6 months of newsletters, okay? Supplements. You guys have to take supplements forever, okay? Trying to educate you a little bit on why you should supplement. Which are the best supplements out there? Where can I find them? How do I get them? Does it really matter? Why can't I just go to Walmart and pay, $9 for 8,000 pills of multivitamin? Why is that not my best option? And what should be your best option and how to get them? Protein powders, different kinds. There's whey protein, there's casein, milk, there's